psychiatrist of NIPID, to deliver his valuable. I'd like to give a welcome address by Dr. G. Srinivas Lu sir.
Good evening, students, faculty, and my dear colleagues. As part of AGAM, Azadi Ka Amrit Mahotsav, we are conducting so many programs, especially flagship programs and awareness programs throughout the country. So, in our country, we have 8 NIs. Through NIs, Government of India is conducting different awareness programs about the disabilities. So, the new RPWD Act has mentioned about the 21 disabilities and its associated conditions. So today, the program in this platform, so the observation day of Schizophrenia Day, International Schizophrenia Day. So on this occasion, Dr. Shravan Reddy sir, Assistant Professor in Psychiatry and Head of the Department of Medical Sciences. Sir will explain about the different causes and characteristics and what exactly the components in the schizophrenia, the condition, statistical scenario, the pros and cons, and the different kind of inputs related to, especially for the short duration, certificate course-oriented, long-term program students. So this program will definitely helpful to all our HRD program students. Now I welcome to Dr. Shravan Reddy sir on this occasion. Over to you, sir.
Good evening and warm welcome to one and all. Respected seniors, my dear colleagues and students and all the faculty, I welcome you one and all on the occasion of World Schizophrenia Day. So as you all know, every year on May 24th, we are celebrating this Schizophrenia Day to create awareness among the general public and all the stakeholders and also the common people who can know. So why means, as you know, many of them know stigma about the mental health. Okay. So as you know, the mental health is very discriminated among the society. Till date, even though we are in the 20th century, 2022, so there is a lot of discrimination and stigma among the mental health. So if someone has a mental health problem, so there I am stigma. If someone knows I am going to a psychiatrist or I am going to a psychologist, so my mind is not good. They tell me that I am having mental problem or I am mentally ill. So there is a lot of stigma and discrimination in the society, even in the 20th century. But in the last 2 decades, because of a lot of activities from Government of India and also from all the professionals, rehabilitation professionals, so this discrimination has come down and lot of awareness among the public media and the social media. So nowadays everyone is opening up about their mental health issue. We have seen many Bollywood heroes, heroines, their Twitter account they are writing that the last 1 or 2 decades. So as you all know, today is the May 24th World Schizophrenia Awareness Day. So today I will be talking briefly about the schizophrenia. Okay, no? So what is schizophrenia? What are the causes? Okay, now how to handle any patient? So what are the myths and misconceptions in the society? Okay, no. So whenever we see a mentally ill person, we have many myths as a common man. So though we are rehabilitation professionals, when we are thinking or perceiving, like in schizophrenia where there are abnormal thinking or perception, even when a common people has abnormal thinking and perception about the mental illness. So regarding that aspect, we will be talking on the schizophrenia. Okay. So you know schizophrenia, so there are the 3 components. Okay, no? One is the thinking, there is a problem in the thinking, so that is your thought process. Okay, no? And the other thing is effect. So there is a problem in your emotions and mood. And the next thing is the behavior. So whenever there is a problem in the thinking, so it affects your mood and emotion and also your behavior. So thought and effect and behavior. So these 3 domains are most commonly involved in the patient with schizophrenia. Next. So why we are creating awareness about schizophrenia? Okay, no? Schizophrenia is a mental health condition. So worldwide nearly 21 million people are there with schizophrenia. So the prevalence of schizophrenia is very high. So 21 million is not very small number. Okay, no? So worldwide you are having nearly 21 million people suffering from with schizophrenia. So that is the reason every year on May 24th we are celebrating the World Schizophrenia Day. Not only in the India, so throughout the worldwide in different countries we are celebrating to create awareness of the schizophrenia. What is this condition? So what are the misconceptions about schizophrenia? So what are the symptoms? What are the early warning signs? So many of them are doesn't have like hypertension, obesity, or we are having early warning signs. So even for schizophrenia also we are having some early warning signs, okay, no? Some early precursors. So where we can identify it at the early age, okay, no? When you are identifying the early warning signs. So regarding this and also the treatment available and what are the myths, so everything. So we are creating awareness on the whole schizophrenia day to the common public. Next. So what is the prevalence of schizophrenia? So the prevalence of schizophrenia is 1% of the general population. So for every 100 births, we are having one person with schizophrenia. So 1% is not very less, okay, no? So 1% is very high prevalence. As you see, mental retardation, the prevalence is 2 to 3%, okay, no? Likewise, the schizophrenia prevalence is 1% worldwide. And also, according to the psychiatrists, there are nearly 4 million people who are suffering with schizophrenia in India. Okay, no? And the interesting fact among this is nearly 90% of them are resisting for treatment. So they are not willing to take the treatment. So 90% is very high in the 4 million population according to the data available with the psychiatrists. So nearly 90% are reluctant to take the treatment for long term. Why? They want to take medications regularly. So that is the problem. Another thing is there are many myths or misconceptions in the society. Okay, no? Suppose you know, no, nowadays any mental illness, there are certain myths or misconceptions in the society. So there is something, someone will say God has entered in his body. Someone will say no, there is someone has done black magic. Okay, no, someone will say no, I touched one lemon when coming on the cycle or bicycle. So that is the reason I am having this mental illness. And someone will say I am not getting something. Okay, no, that is the thing I am having. Someone says I am having God or evil in my body. So that is the thing I am having schizophrenia. So all these are the myths, misconceptions in the society. So which are taking advantage by non-medical people or non-professionals. You can see faith healers or quacks. Okay, they are tying some threads and taking thousands of money. You go to that god or you do something activities or you cut someone goat or like thing they are telling. We can say this is a very common thing we see in the society. Okay, no? When you are taking a history from a psychiatric patient mental illness, so this is the very commonly you see the experience in the history. Okay, no? They say that we are going to faith healer from last 3 years. We are going to some quack, he is giving something, threats is tying, but he is not improving. So that is the thing. So there is a lot of stigma, discrimination. Other thing is there is not much awareness. So that is the main problem. If you are awareness, like when you get fever or when you get stomachache, you go to a general doctor. Okay, no. So like that, when you are having awareness on the mental health, you go to the rehabilitation professionals. But the main problem is you don't know the warning signs. What are the symptoms in schizophrenia? So because of lack of awareness, they are going to the quacks and faith healers. So what are the myths or misconceptions in the society? Okay, no? So very as a common man, okay, not as a doctor or rehabilitation professional. So now we will talk about the common man perceptions about the mental illness or schizophrenia. Next slide. So many have misconception that schizophrenia patients they have multiple personalities. Okay, no? We see in the movies or Telugu movies or Bollywood or some other movies, Hollywood. They say schizophrenia has multiple persons. It's not correct. Okay, no? Schizophrenia persons they also have one personality like us only. Okay, no? It's not a multiple personality disorder. Okay, no? So the problem is with your thought, with your emotions, and with your behavior. Okay, no? That's only the problem. And the second misconception in the society is the patients with schizophrenia they require lifetime medication. Okay, no? So this is also very misconception. Many patients those are coming they will say, sir, one time I start psychiatric medication I want to take for lifetime. Okay, suppose when I'm starting for depression, they say that we want to take for the lifetime. So all these are the misconceptions. It's not like that. So depending on the which episode, whether first episode or second episode or what is the comorbid condition, so we'll select a drug for 6 months, 9 months. Okay, no? So there are many patients with schizophrenia, those who came the symptom free and they are back to their normal routine and they are doing their independent work and they are living happily with their families. Okay. It's not like that if they are having schizophrenia, they want to take medication for lifetime. It depends on the which episode and what are the contributing factors. Okay, all this. Next. And also this is very misconception in common people. Okay, no? That schizophrenia patients are dangerous, they are violent, they will beat us, they will kill us. Okay, no. So this is also one of the very misconception. Not only about schizophrenia, about the mental illness. So when we take the data from the Oxford University, out of 30,000 schizophrenia patients, only 23% are only violent. So nearly 80% they are very calm, okay, no? They are doing their work, So they are in their own world, they have problem in their thought process, behavior or more. So only nearly 20 to 22% they are having the only the violent or aggression behavior. It's not that each and every psychiatric patient they are violent, if you go then they will beat or they will abuse you, it's not like that, okay. No? So this is also one of the very common misconceptions that we are having, okay. No? So even schizophrenia, 23% only violent, remaining are very good patients. And also many questions are raised. What is causing schizophrenia? Okay, no? When someone gets you are having schizophrenia, they will ask what is the cause. So it's like a genetic disorder, schizophrenia. It has environmental component, genetic component, and also there are certain neurotransmitters in the brain. Like in depression, our serotonin levels will be less. So even in psychosis, our dopamine level increases in the brain. Okay, no? So increase in dopamine causes psychosis. So that is the reason what the antipsychotics we are giving, they reduce the dopamine levels in the brain. So increase in the dopamine causes pleasure. If it is more elevated, it can cause psychosis. Dopamine and also abnormalities in the serotonin and glutamate, all these things. Next one. So schizophrenia is a medical condition. Okay, no, it's not something social condition. It's not something. Okay, no, they are all related to neurochemical or neuro abnormality, or it's a genetic disorder. Like autism, it is a genetic condition. Like depression, also you can have some genetic component. Okay. So even some mental disorders, they are having genetic component. Means they run in the families. Suppose one of your family member or one of the parents is having some schizophrenia or depression. So there is a high risk that you may be having that condition. It's not compulsory you will have, but definitely the risk will be more when compared with the general population. So as you know, the schizophrenia term was coined by Bleuler, okay, and also the common age of schizophrenia is 15 to 28 years. So you can see most commonly in the adolescent age and the middle ages only. Okay, no, it's not that after 40 is less common schizophrenia, and also the childhood schizophrenia is also less common. Okay, no? So the most common you see in the late teenage and adolescent age, like 15 to 18 years, and also up to 28 years you can see. But in some cases, you can see married women after 40 years also you can see schizophrenia. It's not like that you cannot see, but the most common age is the 15 to 28 years where you can see schizophrenia. But in 10 years, 8 years, if you are seeing schizophrenia, the prevalence is very, very less, childhood schizophrenia. And also when compared with the male, when compared with the females, male has worse prognosis in schizophrenia. Okay, no? And also the age of onset in the men will be at an younger age. Suppose you are comparing with the female gender, men will be having schizophrenia at an younger age, and also the prognosis will be poor, and also they have more worse symptoms men when compared with the females. So Bleuler is the one who coined schizophrenia. As you know, there are 4 A's. What we say when you open DSM-5 or ICD-10, you can see 4 A's. Okay, one is the ambivalence, one is the autism, and other thing is the affect disturbance, other is the association disturbance. So these 4 A's you can remember in schizophrenia: ambivalence, autism, affect disturbance, and losing of association. So ambivalence is you are not able to decide or making any decision or a judgment. Okay, you are in a confused state. Okay, no. So because of your psychosis, you are in an ambivalent state. You are not able to judge your situation. So what kind of course you want to join, whether you want to get married. Okay, no, multiple questions. So you are not able to judge yourself in day to day. And autism, you are like autism, you are in your own self. You are in your own world. Okay, like in autism children, we are seeing they are in their own world. No contact with the reality when they are playing with the toys. So like that in schizophrenia also they are in their own world. And also affect disturbances. So you can see disturbances in the emotions, okay, no? Negative emotions, all these things. And also the association disturbance, like losing of association, thought process, something you are thinking and when you are speaking also there is no relation what you are talking and what you are thinking. Okay, next. And these are the Schneiderian first time symptoms. Okay, no? So schizophrenia, most common you can see the thought insertion. Suppose you are talking to a schizophrenia patient, what they will say is, sir, some God is coming, or some external force, or my friend is forcefully inserting thoughts into my mind, or some of your relatives. Okay, no? So they will tell someone they are forcefully inserting thoughts into your mind and you are doing that. So that is thought insertion. And thought withdrawal, someone forcefully removing your thoughts from your mind, some external force, whether it may be spirit or evil or some God or whatever may be, or some of your friends or family members, which is not possible in real situation. So, but in schizophrenia they believe there is thought insertion or thought withdrawal or thought broadcasting. Someone will say someone has keep some chips or some satellites, something in my mind. So everyone is observing what I am doing. I am in my house, they know what I am doing daily. So this is a typical you can get this from a schizophrenia patient when you are talking. Okay, no? So my mind is controlled by some external force, whether it may be God or some other human being or some spirit or some demon. So whatever may be the thing. So there is some external force. And also in schizophrenia you have auditory hallucinations. You can see auditory hallucinations. So hallucination is what? Perception without any external stimulus. So no one is there, but I can hear voices. Someone is talking, or someone is scolding me, or someone is commenting on me, or someone is abusing me with bad words. But when my friend is there, he can't hear that voices. But only I can hear that voices. Okay, no? So in all senses you can have hallucinations, auditory, visual, tactile. But most commonly in schizophrenia you see is the auditory hallucinations, third person hallucinations. So you are having three type of hallucinations. One is the first person. So whatever thinking in your thought you can hear. Whatever you are thinking you can hear as a voice. That is first person. And second person is the patient. Some evil is talking to you directly. That is second person. And the third person is two of my friends are talking and commenting on me. So you both are talking and I am hearing you. That is third person. So second person and third person are very typical of schizophrenia. Second person and third person auditory hallucination. And also made impulsion. So the person experiences feelings or thoughts, the acts what he is doing are imposed by some external force. So external force may be anything. It varies from individual to individual. As I discussed with God, some relative, some human being, some evil, anything. Okay, no? And also you can have somatic passivity, some abnormal sensation. Okay, no? That imposed by external force. And also the delusional perception. Next slide. Rahul. Okay, after this slide. And I will play a small video. Just you can see how the schizophrenia patient experience. Rahul, play that video. So this is a small 3 minutes video. So how as a common people we are not identifying schizophrenia. So when we are with the family members, so it's a just small awareness video. You can go through it.
You know, today our college is a like that for this with it.
Just shut up. Okay, just stop bothering me, यार. Constant.
इससे क्या हुआ? छोड़. जाने दे.
Stop talking. Stop bothering me. Stop talking. Just leave me alone. Leave.
Experiencing auditory hallucination. Someone is talking.
अमित और दाल चाहिए? अमित दाल चाहिए या नहीं? कुछ बोलोगे भी? किसी बात का जवाब ही नहीं देते हो, लोगों पे चिल्लाते रहते हो, नल भी दुकान सुबह चले जाते हो। बस ऐसे ही रहो तो, करते रहो तुम्हें जो करना है। वो तो naturally आ ही जाता है, and he deserves it. Most of the time because God is just a failure. I said, क्या बोलूं? Oh God, he's still sitting there with his pajamas on. Oh God, why can't he just go out? मैं घर पे ही बैठा है, कुछ तो तकलीफ चलता है भाई. I don't know. और मेरा लाइफ तो बोल रही हूँ.
Stop, okay? Stop bothering me. Constantly.
Look at your head.
So messy.
Nobody thinks you do.
Ravi, has anybody spoken to you? Leave. Do not belong here. You're drinking a water. You just leave. Stop. Please stop. Please go away. Please go away. Stop bothering me. Just leave me alone. Leave. Please. Stop.
just this is a small awareness video. So just how we feel, okay, no? So how the patient feel, how a common people will feel, okay, no? You can see patient with schizophrenia in their household with their sisters or friends, okay, no? So he's having severe continuous auditory hallucinations. They are not able to understand this problem. You can see his anger, irritability, emotional outbursts, okay, no? Detached from them, going there, okay, no? He's closing his ears, okay, no? Why means he's having running commentary, continuous third person auditory hallucination. So the severity, the patient, the suffering will be very, very severe, okay, no? So whenever the pain comes, we will know that. So when the patient is experiencing that, is a very severe trauma. Okay, no? From the morning the patient awakes till night he sleeps, he have continuous auditory hallucination. So that is the problem. Okay, no? That's the thing. So that's the thing. So these kind of emotional outbursts or experiences, okay, no? The patient knows better than us. So that is the thing. As a caregiver, the role is very, very important in schizophrenia that we'll discuss. I think just you got some idea now of the behavior everything. So in schizophrenia, you are having two symptoms. Okay, one is the positive symptoms, and other thing is the negative symptoms. Positive symptoms are things that are present but should not be. Okay, no. So these symptoms they are not present in a normal individual. Suppose I am a normal individual now. Okay, no, without any mental illness. So these symptoms should not be in my body. One is the delusion, other thing is the hallucination. So if something there is present which should not be present, these are called positive symptoms, delusions and hallucination. Another thing is negative symptoms. So these things that should be present but are not. So negative symptoms you are having, see negative symptoms you can see in depression like anhedonia, apathy, alogia. So not talking to anyone, socially isolated, lack of motivation, you are not doing any work, okay, no, decrease in self-care, okay, no, if you are asking someone to do any work, they won't do. So all these are the negative symptoms. Anhedonia, there is lack of interest pleasure, okay, you are not having any enjoyment. Socialism, you are socially isolated, not talking with anyone. So evaluation, you are not doing any work or task when someone is asking you, okay, no, all these things. Alogia, you are not talking with anyone and you are silent, okay, no, all these. And also in schizophrenia, also you can see the cognitive domain is affected. Particularly in chronic schizophrenia cases like more than 5 years, 6 years, you can see even like ADHD, this attention, concentration, executive function, even they are affected in schizophrenia also. The cognitive domain, memory, attention, concentration, all this. So you can see the experience, disorganized thinking. So they are thinking in a disorganized manner. There is a lack of emotions. You can see bland expressions. So there is no psychomotor, there is no facial expression, no gesturing, no tone of the talk. His body is very calm. So lack of emotions and delusions and hallucinations. What is delusion? You know, no? Delusion is false, unshakable, fixed belief. Okay, now. So